Hi guys, last chapter for this week. This is chapter 29, and it's going to be growth and development of the adolescent. So there is a little bit of overlap with school age and adolescent. You can see that the age range is 11 to 20 years of age. There is a drastic change in physical, cognitive, psychosocial, and psychosexual areas for this age group. They do increase their development. The needs the support of parents and nurses to facilitate health lifestyles and reduce risk-taking behaviors. So they are looking for support of family and nurses to facilitate some of that. The list of risky behaviors by this group can include drinking, drug use, sexual activity, and just other reckless behaviors. Physiological changes, the secretion of estrogen in girls and testosterone in boys can stimulate some of that physical sexual changes. This is where they are now going through puberty. Girls, it usually happens around 9 to 10 years of age, so it's on that low end of adolescence, high end of that school age period. Boys occurs between 10 to 11 years of age. Some biological changes might include breast tissue development, pubic hair in both boys and girls, male genitalia changes. Menarche, or that first menstrual cycle, usually occurs between 9 years to 15 years. Physical growth, there's rapid growth with dramatic changes. We've talked about that. The average height for boys is about 4 to 12 inches per year. Weight is about 15 to 65 pounds. For girls, it's 2 to 8 inches, and their weight is 15 to 55 pounds. The height for girls typically ceases about 2 to 2.5 years after that first menstrual cycle. So they may get all of their height if they start their menstrual cycle at the age of 10. By the age of 12 to 12.5, that's usually when they will stop growing. Organ system maturation, we can look at neurological system. The brain does not increase significantly at this point. It's gotten most of its growth. As far as respiratory system, increase in diameter and length of lungs, the volume and vital capacity increases. This is when you're going to start seeing some vocal cord changes. Laryngeal cartilage, larynx, pharynx, vocal cords all have those changes that produce that voice change. So this is when those boys and even sometimes girls can have that deeper voice kind of set in. Cardiovascular changes, we're still seeing some increase in blood pressure and decrease in heart rate. When we look at our GI system, they have a full set of permanent teeth, musculoskeletal, ossification of the skeletal system is still incomplete until that really late adolescence. Shoulders, chest, and hips are become very broad and increase in size. Skin is usually thick and tough. They do have those sebaceous glands. They're more active, so we're seeing more acne. Their sweat glands are also functioning at an adult level. When we look at psychosocial development and Erikson, this is identity versus role confusion. So tasks of developing their own sense of that identity. This is where adolescents are going to revisit each of the previous stages of development. Did it start with trust? Did they get what they needed? Were their needs met? Did they strive to find out who and what they could put their faith in? Did they move into autonomy? Were they able to express their individuality in an effective manner? Did they reach that initiative where they could see what they might become? And then industry, did they choose those different activities, whether that be school activities or community activities? If all of those things were met and the expectations were achieved, then they're going to know their identity. They're going to have a good sense of who they are. If they did not maintain or reach any of those stages, that's when their confusion sets in. They have the inability for sense of self, which causes some role confusion. As far as Piaget, this is formal operations. So they move from concrete thinking to abstract thinking. Thinking becomes more logical, more organized, and more consistent. And you can see the different stages that they go through based off of those age groups. As far as motor skills, they usually are going to focus now on one activity. They may play a sport, they may play an instrument. Their concentration increases. They're able to follow complicated instructions. They have good use with computers. They have increased finger dexterity. So their gross and fine motor skills are still very much intact. As far as their language skills, by late adolescence, the language skills are comparable to an adult. This age group wants to be talked to as an adult during an exam. So how do we improve communication with our teenage population? We want to make sure that we're taking time to discuss their concerns without interrupting them. We want to talk face to face and be aware of our body language. Make sure we're asking questions, we're choosing our words carefully and thoughtfully, we're giving praise and approval, we're speaking to them as an equal. Don't talk down to them as a smaller child. And then just being aware of our tone and our body language. When we look at emotional and social development, this can really be affected by their relationships with their parents, self-concept, and body image. And they're important to their peers, and sexuality and dating. All of those can affect our emotional and social development at this age group. Families and parents of adolescent experience change and conflict that require adjustment and understanding. Parents have to learn to let go while the adolescent establishes their independence. This adolescent family relationship is essential for the nurse when she's caring for this population. As far as the self-concept and self-esteem are often tied to body image, adolescents perceive their body as being different than their peers or less ideal to themselves. Body changes are important to the adolescent's self-concept. Peer groups play an essential role. They have companionship, they're social groups, they share problems, they are stable, they share problem stability in times of stress. And then sexuality is definitely going to increase as dating starts to increase. So promoting healthy growth and development, remembering sports and physical fitness should be a daily activity. They're learning to participate in school activities, and they're usually solidifying it down to one. Safety issues, remembering that this patient population are risk takers. So making sure we're talking to them about safety. Proper nutrition and healthy eating habits, again, is going to help with the obesity issue. Healthy sleep and rest, personal care, healthy sexual life, and appropriate discipline. So when we break down some of these risk-taking behaviors that can be involved with this patient population, unintentional injuries, factors that can place that teen in a vulnerable situation between knowing what is right and wanting to impress their peers. Motor vehicle accidents lead unintentional injuries for this age group. Poisoning rates are on the rise, and this usually occurs from prescription misuse and overdose. What is the biggest concern with this age group now? I would say vaping. and understanding the risks of vaping. A lot of times we don't know what's happening with those vapes or what they're actually inhaling and what's going to happen 10 years down the road. So again, just talking to this group about that. Motor vehicle accidents, we just need, as nurses, we need to educate on driver's education, seat belts, laws about numbers of passengers, curfews, things like that. Firearms, we need to focus on gun safety, locking them in a safe location, keeping the ammunition away from the firearm. Nurses must educate about car, firearm, and water safety to prevent these unintentional injuries. Calorie intake really depends on the teen's activity level and growth pattern. If they're highly involved in sports, they may need some more calories. So just understanding that we're still promoting those really healthy nutritional behaviors. This assessment here helps the nurse to guide the adolescent in making better food choices at home and in those fast food restaurants. We want to make sure we're promoting personal care, general hygiene tips, caring for body piercings, tattoos, preventing sun tanning, and promoting healthy sexual identity. So making sure we're encouraging our teenagers to frequently bathe and use deodorant. Make sure they're washing their face 2 to 3 times a day. This is going to help, especially if they have really oily skin due to some hormones. We don't want them to vigorously scrub that face, though. That's going to irritate the skin and lead to follicular rupture. Making sure they're shampooing their hair, removing excess oil from the hair and the scalp. If they have any piercings, body piercings, and tattoos, make sure they're going to someone qualified. It's a sterile field for both. The biggest concern with this is infection, so making sure that cleaning is important. Sun tanning, there's no such thing as a good tan. Ultraviolet rays put people at risk for skin cancer, so make sure we're talking to this adolescent group about sunscreen. Other developmental concerns can include violence. We can define violence as an intentional use of physical force of power, threatened or actual, against another person or against a group or community that results in high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. Homicide, suicide, dating violence, gangs can all need to be addressed. When we're thinking about gangs, adolescents who are gang members are more likely to commit serious and violent crimes. So as nursing interventions, we need to talk about violence prevention. We need to monitor social media, television, and music. A lot of times that music is just reinforcing that violence. Know who their friends are and monitor those negative behaviors and actions. So the risk of being involved in an unhealthy romantic relationship, we can think about dating violence. Those are those short-term, lifelong effects that can happen if you're being hit, slapped, or physically harmed on purpose. That's violence. Risky sexual activity, increased sexual partners is just going to increase that risk of STIs. It's also going to increase premature pregnancy. So as far as interventions, we just need to educate on those healthy relationships. Common substances that are used by adolescents that can be abused are alcohol and prescribed medication. Prescribed medications being things like Ritalin, oxycodone. We can see patients using, or teenagers using hallucinogens, sedatives, analgesics, anxiolytics, which are benzos, antidepressants, or sleep medications. They may get into steroids, inhalants, stimulants, opiates, or various club drugs. Some of the club drugs that become really big issues are ecstasy, GHB, LSD. It says 1 in 5 12th graders report having used a prescription drug without medical supervision, and 1 in 9 8th to 12th graders have inhaled household substances to get high. So the topics for discussion to discourage substance abuse are listed here. Remembering when we talk to these adolescents, we need to talk about short-term and long-term effects. What are the risk factors and implications? The how and the why of chemical dependency, the impact of substance abuse on society, the importance of maintaining a healthy lifestyle, resisting peer pressure, and having confidence in their own judgment. So if we have a hospitalized adolescence, a couple of things that we can think about is making sure we're providing opportunity to maintain their independence, allowing that adolescent to participate in some of the decision-making process, and encouraging socialization with friends. That can be through phone, text, and even visits if possible. And that concludes chapter 29 on our adolescent growth and development. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.